filler. So let me introduce you first to Carmelie, our lovely model. Thank you very much for volunteering, Carmelie. And Caroline will be assisting us today. Just to give you a little background about me, I'm from the UK. So I am a dentist by trade. I've also specialised in aesthetics in terms of Botox, fillers, skin remodelling treatments, PDO threads, and I travel back and forth to the UK for conferences and to also train other doctors and dentists. So moving on to today. So what I always start with, and the most important thing about aesthetics, is the initial consultation. Yesterday, Carmelie and I met, and she expressed to me that her main concern were the lines that were running from her nose to her mouth. She felt that they were grooving a little bit and having an overall anti-aging effect to her face. So, although it's really important and we need to make sure that we address the client's concern, we also don't want to have tunnel vision. So we want to be able to also understand the client's facial proportions, her other features, and make sure that what we're doing is going to complement her face. So, Carmelie's got a lovely oval face, and that is the most aesthetically pleasing face shape. So we want to respect that. We don't want to overfill the nose to mouth lines, and we want to soften them without creating a rounder look to the face. So we're going to be very, very careful. We're only going to do a little bit today, but we're going to end up with a really lovely result. The other thing we want to make sure of is we want to have a look at her skin quality and have a look whether the dermal filler is going to blend in nicely to her skin or whether she needs to go on a course of skin treatment first. Now, luckily, Carmelie has beautiful skin. She looks after her skin, and the filler today is going to integrate really beautifully. Lastly, also, we want to make sure that we're looking at other areas of the face and we're recommending other little tweaks and things that could improve. So, for example, Carmelie's got beautiful smooth skin. I don't necessarily think that Botox would be something that would be on the priority list. However, we're starting to lose a little bit of sculpture just on the chin line there, and it may be that Carmelie considers a little bit of a PDO thread lift at some point, just to re-sculpt the jawline and to give that definition to the face back. Okay, fine. So what we're going to do, we're going to start the demo. So I'm going to glove up, I'm going to pass this over to you, Caroline. Okay, so I don't know if you can still hear me, but Carmelie, I've already numbed her up, so she's really, really nice and numb. So the treatment should be lovely and comfortable. The technique that I use is a cannula. So I don't use needles around the nose to mouth area. It's a lot less traumatic, it's a lot quicker, it's a lot easier. So this little point that I'm going in now is the only point that I'm going to make an incision. Oh look! Thank you, Carmelie, thank you. Okay. So I'm going to make a little, just turn this way, lovely. I'm going to make a little entry point here. Now this looks brutal, but honestly, she's already numb here. So it's going to be really, really nice and comfortable. Can I give that back to you? Can I get the filler, please? Can I get some cords? So the other thing about the nose to mouth area is there's a lot of vessels that lie just around the nose area. And the last thing we would want would be to use a needle around that area and to potentially damage that. So with the cannula, it's blunt, so it's completely safe. Yes, there's still a little risk of swelling and bruising, but a lot less. And I'm going to move you a tiny bit that way. So just pop your back slightly. Stop popping your back. Perfect. So we're just underneath the skin here now, and you can see my cannula is just coming up towards the nose area. I don't know whether you can see that there. You might want to come around from this angle and see. So right now, I'm just filling a little bit around this nose area here. I don't know how much you can see. And I'm drawing this back, and it leaves a beautifully smooth result, like that. So you can already see around the nose area, it's just started to clump up a little bit now. Good, perfect, perfect, perfect. And Actually, I'm just going to do a teeny tiny touch more here. How's it feeling, Carmelie? Good. Looking after our model. Okay, lovely. Isn't that nice and comfortable? Yeah, perfect. So you can see on that side there, you can see that really we've filled in just around this little nose area there. We haven't overfilled it, but also we've left nothing in terms of swelling, bruising. Very quick, very comfortable, very easy. So I'm just going to come around and do this side. Lovely. And if you want to come see Carmelie's before and after photos, then you can pop past the stand at Commander Bay Aesthetics and you can come and see the befores and afters next to each other. Lovely, so that's the treatment done for today. Really nice and quick, makes a lovely difference. We've really softened the nose to mouth lines. And what we might do in the future is we might do a teeny little bit at the corner of the lip, just to lift the lip a little bit slightly. You can see that the mouth position's just ever so slightly dropping down there. And we can pop a little bit of filler, delicately placed just at the corner of the mouth, just to lift it ever so slightly. So the important thing with the aesthetics is we want to get a balance between obviously knowing your facial anatomy, having skills and experience, and also having an artistic eye and knowing what looks good on and who will suit which treatments. So thank you very much to Carmelie, thank you Caroline for assisting, and if you'd like a further discussion then I'm over at Commander Bay Aesthetics at booth 25. Thank you. Woo! Thank you, Carmelie.